Μπορούμε να δείχνουμε πάντα νέοι. Μπορούμε να δείχνουμε νεότεροι από την ηλικία μας, απαντούν οι γιατροί αισθητικής ιατρικής. Για τα νέα μη χειρουργικά όπλα που διορθώνουν χαλάρωση και ρητίδες, μας μιλά ο διεθνούς φήμης πλαστικός χειρουργός Franco Vercesi, ο οποίος βρέθηκε στην Αθήνα, στο Πανελλήνιο Συνέδριο Πλαστικής Χειρουργικής. Mr. Vercesi, Botox and hyaluronic acid have long been the most popular injectables. What is the next generation of them?
I think the next generation is a most evolved filler. Now we are used to see the filler as a substance that you inject and just create a volume. The new generation is a polycapprolactone filler. It's a totally absorbable filler, so very safe. But you can restore the volume of your face, but you can also stimulate your own collagen to create the volume and to improve the quality of your skin. So the next step is not only to put a volume, but to stimulate your body to create the right volume. So the results are more natural, very safe, and very long lasting. You can have a correction lasting 1 year, you can have a correction lasting 2 years, and sometimes you can have a correction lasting 3 and 4 years for determined area of your face.
Are you in favor of getting injectables at the age of 25?
Why not? Depends what you have to correct. I saw many very young girls and boys have a correction of the nose, of the chin, which changes the life without surgery. Safer, fast, why not?
How do we age?
So, we have to keep it simple, but just to keep it simple, to give an idea on the face, we age in 2 ways. We lose the volume of the deep fat bed compartment. The superficial fat changes with your weight, but the deep fat changes with your age. So it means that with the time you lose, especially in this area, the fat, and you lose the volume here. This is why the old people age and has this situation. So the vector of relaxation are much more vertical because the skin moves down in a direction of the gravity force. We lost the volume here in the temples, here in the angle of the mandible. For the woman, very important is the chin because the bony area of the chin lost the volume near the age of 45, 50, near the menopause. So what happened? That the chin reduced and the skin move up. So we have to put something to reshape this area.
Reversing the signs of aging also concerns skin laxity. What are the major advances about this?
On the market, the advent of the sutures or suspension suture changes a lot the opportunity to treat the skin laxity. But what we must be really clarify is that we cannot do a surgical lifting. We can give a strong and a very nice support to our skin. So if we have a skin laxity, with a very simple procedure, we can just put under the skin absorbable suture with opening cones that maintain the skin in a better position. If you do this, you have a double effect. You have a mechanical effect of suspension of your relaxed skin, but around the suture, you create a strong stimulation of collagen type 1, the normal collagen of your skin, lasting more than 2 years. Combine this procedure with the correction of the volume, you really reshape in a very natural way and in a custom-made way.
Which age group will benefit most from a thread lift?
It depends on the indication, because for example, if a young lady, 30 years old, has a relaxation of the skin, of the jawline, you can support the skin also if the patient is very young. Classically, the middle-aged patient, 40, 55, like my age, is the one where you have the relaxation of the skin. So the skin is relaxed, but not too much, so you can give a stronger support. But in the older patient, why not to use it? Also, if the skin is very relaxed, and maybe the best indication is the surgical lifting, but the patient don't want to go under surgery, the patient want to improve step by step in a soft way the face, you can use the suture, the threads.
Are all thread lifts the same?
No, The answer is very easy, is not. Not all the threads on the market are the same. We are scientists, we are doctors, so we must always start from a scientific evidence. We have a PDO threads that people say stimulate collagen, but actually some study done in Italy show that after 6 months you have not any evidence. The open and cons polylactic acid threads has been very well studied. So you have a stronger fixation, a strong support with the skin, because it's been demonstrated that the cones grasp the skin in a better way with a stronger power from all the other suture. But also they are the only one where it's been proved that in the human being has been created a stronger collagen type 1 stimulation around the suture. So you have a double effect. You have a mechanical support effect and a real anti-aging collagen stimulation effect. So not all the threads are the same.
From cutting and pulling, we are moving towards collagen stimulation. Is this an alternative to a facelift?
No, it's an opportunity. If you use this incredible family of products, the collagen stimulator and the support threads in the right way, you can really delay any kind of surgical lifting. Surgical lifting still have a space in the field of plastic surgery, obviously. And another thing that is very important, now men and women work a lot. If you do a surgical lifting, you must stay at home at least 2-3 weeks. If you do threads, if you do an injection of a collagen stimulation, the day after you can work. So this is another problem that the modern men and women have.
Studies on twins have shown that prevention is a key factor in the way we age. What kind of measures should we take?
First of all, there is a great part of genetic. This is clear. But also, if the genetic is very important, the lifestyle is very important. Obviously, it's important to laugh in the life. It's very important to do a job you like. It's important to make sport. It's important to eat and to drink in the correct way. Everybody knows it. But sometimes it's not possible. Aesthetic medicine can help you with collagen stimulation, can help you with restoring the volume where you lose it. It can help you in an incredible lot of ways.
How should a patient choose a doctor for his aesthetic medicine treatment?
First of all, you have to see the doctor. To see the doctor is very easy, because you can see the doctor before to meet him, because with the social media it's easy to find, and to look if the doctor is really a doctor. If you want to do something, go to the doctor and take a consultation, a real consultation, because you are not a client, you are a patient for me. So as a patient, I have to take care of your medical history. I must be very professional. And to do this, I have to tell you which kind of product I use. You must know the product you have inside. You must go at home with a target, with the product you have in your face. This is important. And especially in the moment of crisis, you cannot fight with the prices. The too much low price, it means that you are not using a good product, or you are not using the right amount of product. What you put in your face is very important. It's your face. You are a patient.
What does the future bring us in anti-aging?
The future of the anti-aging is the quality of the product and the quality of the doctors and the quality of the distributors too. Because if the companies work in the right way, looking at the training and the scientific evidence more than to the money, we will have a very nice future in front of us with anti-aging treatment of all the kind possible with the new science, but from good doctors, good company, good products. For me, this is the future.